Good afternoon. I'm Danna Mauch, and I'm here to welcome you on behalf of the Massachusetts Association for Mental Health. I'm pleased to have you attend the first webinar conversation in our series, Wellbeing in the Time of COVID. We're launching this series, which is going to take place over the next few months, in order to provide information about behavioral health during COVID-19 and offer strategies for both protecting mental health and promoting well-being. The series provides an opportunity to initiate discussions that we hope is going to provoke both thought and action, so that members of the community at large, professional caregivers, and service systems are well informed about the effects of the pandemic and about solutions to better meet the personal support, behavioral health, and related needs of Massachusetts residents during this very challenging time. We're honored that Health and Human Services Secretary Marylou Sudders is here to kick off our series with today's webinar conversation, Supporting Frontline Staff and Caregivers. When we approached the Secretary about joining us today, she asked to specifically focus on this topic, which is a top priority for her. I've heard it said that COVID changed everything, and I would caveat that to say almost everything. From my 40 plus years of working in public health systems, I know that frontline workers providing compassionate expert care to people who are sick, injured, frail, and lonely are the heart and soul, not just of the healthcare system, but of the values framework that reflects who we are as a society. And that hasn't changed. Despite COVID, you all continue to show up every day to help people who depend on you, whether they're in nursing homes, hospitals, group living environments, senior centers and referral agencies, or in their own homes. What has changed, though, are the many challenges that you now face, both at work and at home. I'm really grateful to be able to join Secretary Sudders today to thank you and to talk about the ways that the Commonwealth's COVID-19 response protects and supports workers. We're hoping to respond to the questions that many of you have raised about what happens next, and we're excited that more than 300 people have registered for today's webinar conversation. To accommodate everyone, you are in listen-only mode. If you'd like to share a comment or a question for Secretary Sudders or me, please type it into the Q&A box at the bottom of your screen. Know that your questions will be seen only by our team, not by the whole audience. And because there are so many people at this event, and we want to ensure that we see your questions and comments, the chat feature has been disabled. So many of you submitted questions in advance, and I want to thank you for that. And we're going to try to respond to as many questions as we can, both those submitted in advance and those you may submit in the Q&A. We'll work with the Secretary to try to address any questions we weren't able to address live in this session today. Before we get started, I'd like to remind you that today's webinar is being recorded. And if you would like access to closed captioning, please click the closed captioning button at the bottom of your screen and choose Show Subtitles. And now it's my pleasure to introduce Massachusetts Health and Human Service Secretary Marylou Sudders. The Secretary needs no introduction to this audience, nor does she need any introduction to the Massachusetts Association for Mental Health, having served in the board for many years prior to her appointment as secretary, for which we are grateful. However, I will briefly exercise the prerogative of the host to say that her decades of frontline program operations experience, combined with long tenures leading state agency and nonprofit service organizations, and tempered with a deep determination in the face of compelling human need, enabled her to launch into uncharted territory and tackle the unexpected challenge of managing the Commonwealth's response to the COVID-19 pandemic. You have our gratitude, Secretary Sudders.
Thank you. Well, thank you, Donna. Thank you for having me today. It's always good to be with my friends from the Mass Association for Mental Health. And in full disclosure to everyone, I was both a member of the staff of the Mass Association for Mental Health at one time and a long-standing board member. So it's thank you for having me. It does seem like a century ago, although it was only last March. And I'm not sure I ever really thanked you and the Blue Cross Blue Shield Foundation for the innovative network of care, which really does feel like a long time ago, which actually has served to help folks navigate behavioral health. And it's a resource. If you're not going to plug on this webinar, I'm going to plug, because we are all in this together during this period. And I just want to thank MAMH for all the work it does to bring face and voice and courage for people with mental illnesses and to support their families. So I just want to thank you for that. So first of all, to the 300 people who I can't see, I want to thank you. I want to thank you for your resolve since March. As the governor and I have said, it feels like one long day. I actually don't often remember what day it actually is. And COVID is going to be with us until such time we have a vaccine. And so it's going to take all of us collectively to stay strong and to support one another as we navigate these just completely uncharted territories. And hopefully there's lessons from all of this that will help strengthen us going forward. One of the reasons when Donna and I had this conversation, and of course I said I would participate in the inaugural, that I wanted to talk about frontline staff and caregivers is because in the beginning of the pandemic, and we were so focused on first responders, and I think often people think about first responders only as, and they're very important, as our physicians, our nurses, and our police and fire and EMS. All of you are also frontline workers. And as Donna said, we come to work in the face of extraordinary challenges because we believe in the mission of what we do, and we know that to support other people is so important. And I don't have a lot of answers, but I want you to know that it is important to us to find the tools and the mechanisms to support frontline workers and caregivers, because if we can't help you take care of yourself and acknowledge what you have done, you won't have the strength to carry on. And so one, I want to thank you, and two, to have a conversation with Donna about what we have done, what we need to do more of, and to acknowledge, to support one another as we go through this pandemic together. Because I would love to tell you I have a vaccine in my back pocket, or that I know that there's one around the horizon, but the truth is it's probably not until next year. So that is why I wanted to focus on, obviously, behavioral health, but on frontline staff and caregivers, because it's just so important. And we don't often take the time to pause and take care of ourselves because of what we do. So thank you. Let me turn it back to you, Donna.
All right, well, thank you for those thoughtful remarks, Secretary Sudders. Why don't we jump right into some of the questions that many of the stakeholders on this webinar have asked. So the first set of questions really focus on how we're coping during COVID-19. And in that spirit, I want to ask, what is the Commonwealth doing to protect frontline workers and their families from COVID infection?
So I would hope for all the things we need to do more of or better of, that when we came in March, we made a number of announcements. One was around defining who essential services workers were, which of course included frontline workers. When we had to close daycare and set up emergency daycare, we sent that up specifically for frontline workers because we knew you'd be unable to work if all of a sudden daycare was also not available to you. And again, there was no, and I don't mean this in a disrespectful way, of course, there was no playbook on what do you do as a pandemic sort of rushes at you. And so some of the things we tried to do early on coming out of in March into April was in fact to stabilize frontline workers and caregivers. Let me give you a couple examples. So one obviously was designating frontline workers as emergency services workers. Second was quickly standing up emergency childcare because we knew people would not be able to work if you didn't have that. Protecting in a very innovative way. We have 40,000 individuals who rely on personal care attendants, and in a very creative way, working with 1199 SEIU 1199. I don't know if Tim is one of the 300 people on the phone, but working with him and with PCAs and with home health agencies, cobbling together basically the emergency supports in order for individuals who need PCAs, to manage their daily living and to have the supports they need so that they would end up not being hospitalized or placed into nursing homes. And that worked well. And again, that was actually support for both individuals who needed supports and for PCAs who became COVID positive and couldn't work. So, that was again, and I just want to, it's a shout out to everybody for their creativity of, right? We just like what we're doing to get through this. Believe it or not, and I'm sure if Lydia and other people are on from my friends in the trades, they'd say we probably didn't do enough on rates. But one of the things we tried doing across all of Health and Human Services and into EEC and into residential schools, for example, was to acknowledge the pandemic and some of the extraordinary costs involved by increasing rates, reimbursement across the board for providers in order to support the people that they take care of, to support their staff, to address PPE, which could be a 4-letter word on bad days, and to acknowledge that we were in this together. And again, during the height of the pandemic. And that you may say, well, that doesn't really feel like a support, but that was one of the things we tried to do in government to be supportive to folks. We tried to take off regulations that in a pandemic, we have a different way of doing work together. Telebehavioral help, telehealth. If there's any silver lining in this pandemic, it was the governor's emergency order, one of many that created telehealth. And it was very important for us to have telehealth and telebehavioral health in parity. I mean, that was never even a conversation that telehealth should be at anything less than what an in-person visit should be. And why is that important to frontline workers? Because if you feel stressed and wanted to access behavioral health, for example, telehealth has just completely changed in a positive way access for people who don't have a lot of time, who can't take time off from taking their other responsibilities. And I've only heard really positive things about telebehavioral health, and I'm hoping working together we can see that as a support going forward. But another thing that we have done, or we've tried to do, is the governor talks about they're not daily anymore, thank goodness, but the regular press avails around supporting one another, acknowledging the stress that's involved. We don't shy away from this because it is a very stressful time for people, both work, personally. It's isolating. The very time that we want to be together, right, is the time when we're really apart from one another. And what can we do to break down some of those, some of that isolation? I worry about isolation and the impact it's having, particularly on people who are vulnerable. I mean, honestly, Donna, one of the hardest decisions I ever made was the decision to stop visitation across the board. I talked about that very openly. Or when we basically at funerals and things, right? The time when people need to come together was a time when we were putting rules into place that basically stopped some of the most basic things that we do as members of our, communities and society. So I do worry about the isolation impact, isolative impact of the pandemic on us in the long run.
Well, thank you. Your comments really reflect an understanding that caring for COVID patients and actually caring for others who are vulnerable at a time when there's so much risk of infection is exhausting, both physically and emotionally, for many frontline workers. I'm wondering, as you've talked about various resources that are available to support people, are there other things you think we need to do?
So I think acknowledging stress, you've heard me say this before, asking for help is a sign of strength and not weaknesses. How we talk about supporting one another, I think, is very important. I have to say, since I've been in my command center mode more than being Secretary of Health and Human Services, I mean, the good news for me is I have such an extraordinary group of folks, colleagues in Health and Human Services that I have worked with over a number of years, that literally handing over the daily operations of Health and Human Services to Dan and Colleen and my two undersecretaries and Alda Rigo and Rob McLaughlin and the like, really gave me that opportunity to just focus on the command center. But if I recall correctly, we were working together on a public awareness campaign, and and I think it's called What If, which is really to address, in fact, how people cope and feel isolated and the like. And I am hoping that some public awareness around what's happened. And I know we pivoted a bit, which was important because of where we are in the pandemic. But I'm hoping some of the public awareness that comes out around what if and isolation and depression and how people are feeling and us coming together as a community will be one important. I think data, I know that sounds wonky to people. I mean, I think the other thing we've tried to do is to give people just the real information. It's, transparency of data, transparency of information, because a pandemic is frightening to many people, right? The unknown, what's going to happen. And I think the more information we have and share with one another, I think that also plays to our strength as a community in Massachusetts.
Well, to borrow that last word about strength and your advice that it's a sign of strength to ask for help, there's a group I'd like to ask for some more help from. The Commonwealth ranks among the states with the most behavioral health providers per capita, and yet many people do not have access to treatment because the providers refuse, really a majority of providers refuse MassHealth and even private insurance. I'm wondering how we can encourage and support more behavioral health providers to accept third-party payment. We need their help.
Well, it's been a long-standing opportunity and challenge. I do think I think a couple of things. I think when the governor made this statement, when we rolled out telehealth, that we believed in parity for all telehealth, but we actually signaled behavioral health being so important to us that and telebehavioral health being, I believe, very well accepted by both clients and providers, that actually will open up opportunity. I think it actually will increase the amount of providers willing to accept insurance and the like. I've really, I mean, there's not a provider, a large provider I've heard from that has not like embraced telebehavioral health and seen the positive of it, because if for no other reason, their no-shows and cancellations have decreased significantly. So I don't know whether, as I point out to them, you know, when someone is experiencing a mental health condition, and whether it's anxiety or depression or, you know, the weight of it on you, it can be very heavy. And if you have to get in your car or take public transportation and get across town to get to wherever your provider is, to then wait in the waiting room, and then there's a lot of things in that. And if you're not feeling well, it just makes it that much harder. And I do think telebehavioral health takes some of those challenges and obstacles off of someone. And so I think it's a win-win for both the client as well as providers. So some providers who I was a little worried they were going to actually be reducing their footprint actually are embracing telebehavioral health. But, you know, it's a long-standing, I think the more we talk about behavioral health as, you know, part of healthcare, which we do, as you know, in this administration, Governor Baker is very clear when he talks about health. He's talking about physical, behavioral, and oral health. It's health. And I think the more we talk about it that way and we encourage people to enter the field, I think we will see expanded access. But it won't be in my lifetime that we'll probably see more providers than we have need for.
Well, in a related matter, to be genuinely responsive to disparities that we know are being faced by people of color during this pandemic. Disparities both in the rates of transmission of COVID and in the disparate impact of the illness on these communities. What can be done to engage people from communities of color in working strategically with the state to minimize these impacts and disparities and address some very genuine and plaintive needs?
So a couple of things. I think the pandemic and the disparate impact on people in communities of color and the murder of George Floyd have come together, and you know, inflection point is too mild a term, but really a point in time in our history that really requires, forces, whatever word people want to use, to really look at every issue of institutional racism. And that extends into behavioral health for both individuals who have behavioral health conditions as well as providers. I mean, I remember when I was Commissioner of Mental Health, of a study that was done and of individuals, and it was a disparity study, looking at individuals who had similar symptoms, and people of color, you will remember this, people of color were diagnosed with more serious diagnoses like schizophrenia or bipolar illness, and individuals who were white were diagnosed with lesser conditions when like the symptoms were exactly the same. So I've never forgotten that lens around disparities, particularly on individuals who were, you know, patients of the Department of Mental Health. And on the provider side, for whatever reasons, and that when you look at the professional degrees, individuals of color are a minority of minority within the workforce, other than at the very direct care level. And so what are we doing to create the legitimacy of career paths to encourage individuals that behavioral health is a good career, and not just entry level and there's no career path for people. So it is, both are areas where we need to be very focused on, is to ensure individuals who need services and supports get the services and supports they get in a health equity lens, as well as creating opportunities to really change the nature of the workforce, to reflect the diversity that is in Massachusetts. We've done some things in this administration. They're intentional. They're probably not far enough around creating career paths and educational. We've done some things to the Mass Health program, as you know. I asked the Commissioner of Public Health to really lead the Health Equity Health Equity Advisory Group to look at issues of health equity and the issues of institutional racism in health, and make a number of recommendations. And it's both individuals and communities of color, but also people with different disabilities. And that group represented a broad cross-section of individuals. It was, the recommendations are actionable, and I've asked the commissioner plus the other secretaries in the governor's cabinet to really embrace the health equity recommendations for us to really make some tangible changes. But we have a long ways to go to really address institutional racism throughout, not just the Commonwealth of Massachusetts, at all levels, including creating true career paths for people. And it's, and hopefully sustainable change, and not, I want sustainable change, not, just create a fellowship, right? But like really, truly institutional change. And I think that's going to take all of us. Health and Human Services doing a fair amount internally to really evaluate all of our structures and unconscious biases and the like, to really look at ourselves hard within Health and Human Services, and to ensure that we address unconscious bias quite intentionally. But we're on a journey, and this is a journey.
Well, thank you for that, Madam Secretary. I just want to comment that the whole effort to develop career paths is so important for frontline workers in terms of their long-term economic security. People take these jobs, as entry-level workers particularly, and really need to be able to move up over time and develop a better salary base and benefits base and whatever to sustain them in these jobs in the long term. So frontline workers are facing many challenges, but now during COVID, they're also confronted with trying to manage childcare issues, being obviously created because of the pandemic and the need for protections in schools. Given the anticipated surge in the fall, something we're perhaps seeing some preliminary signs of, and the likelihood that many schools will continue remote learning or some mix of remote and in-person learning, and risks that daycare centers might close again. Could you talk about any resources the state is developing to help with this? And I might just note that particularly for frontline workers, they, unlike some workers in other industries, might be able to manage this a little more easily because their remote work is possible to do at home. It's not feasible to work remotely.
Right. Frontline work is not remote work.
Not remote.
Not remote work.
So whatever, your thoughts about this would be appreciated.
Sure. So reopening childcare. So the command center is this nimble, sort of nimble, small entity that sort of sits within the administration, but not within the secretariat, if you would. So it's like this. It's not a ragtag group of people by any means. I mean, it's some of the most skilled and creative people, both in government and a number of people who had worked in government. I sort of invited them back to volunteer their services to the Commonwealth plus McKinsey. But so originally, I'll get there. Originally, the command center was focused on really managing through the worst of the surge. So it was personal protective equipment, hospital capacity, homelessness, testing. Nursing homes obviously became very focused. We took on food insecurity, created the food security task force to deal with communities that were really saw significant food supply chain issues happen. And early education and care found its way into the command center because of emergency child care was limited, and there was only so much that the Department of Early Education Care and Commissioner Sam, who's terrific, could stand up and sort of monitor without a regulatory framework. So reopening childcare became part of the command center sometime in, never trust me on a date anymore, but sometime in June or late May, to what would we need to do to safely reopen childcare. I've learned a lot about childcare, never thought I would need to. Before the pandemic, we had 8,200 childcare sites, licensed childcare, family childcare and center-based in Massachusetts. It was almost 50-50. And at this point, 65% of childcare has reopened or has approved plans to reopen now through September. So it's not what we had pre-pandemic, but it's about 65%. The guidances are clear to child care programs. There's all change is change. But so 65% are open or about to be open. It's working pretty well. There's some geographic disparities that Commissioner Sam is very focused on. And we made a commitment around subsidized childcare, that we would provide enhanced funding over the course of about 6 weeks as childcare was starting to reopen, if they provided subsidized childcare. And that was specifically for frontline workers and low-income families who, in order to work, need to have childcare available. So, I don't consider anything in a pandemic a success story, but that has so far worked well, because we know in order for people to be able to work and feel safe, they need to have safe childcare. And despite today's story in the Boston Globe, or yesterday's story in the Boston Globe, cases of COVID, if there's a suspect of COVID, is reported to the local board of health and is investigated and the like. So I'm feeling okay that we're on a reasonable path on childcare. And if schools reopen, we're going to have after-school programs available so that families can work and not be afraid. So that's part of the reopening strategy with schools.
Thank you. You mentioned before telehealth and the importance of it during this time, and we've had some questions from the participants about it. PAL, the Parent and Professional Advocacy League, did a study recently of families of children who have social and emotional conditions. And they found that while families prefer face-to-face meetings, they also believe that telehealth, even after COVID, can be an effective tool for regular check-ins. Also, while the families are grappling with challenges of weak internet connections in some cases, the ability to use phone only has been critical for folks. And young people who responded noted that for them it was really important to have privacy. And so the use of phones enabled that, where a screen that might be shared by the whole family did not. We know that, agencies, some of the clinicians we've spoken with have been challenged by the no-show rate reducing to nearly zero, which is a great clinical outcome, but challenging when you're trying to kind of manage your administrative work during those no-show periods. There are a number of issues, obviously, but it seems to me the consensus is that this is a very valuable tool and worth carrying forward. And we have action from the administration, we have action in both branches of the legislature, trying to extend the considerations that the governor first issued in removing barriers to telehealth. Are there other opportunities for improving this or protections for staff and service users that ought to be in place that this community could be helpful with?
So the telehealth, which was created under a governor's executive order, which actually does match what we had put in the governor's healthcare bill, which does seem like a really long time ago, which was only a year ago, not quite a year ago, when we released the governor's 96-page healthcare bill. So the telehealth that exists presently that we're all using, with the exception of Medicaid, will expire at the end of the governor's emergency orders unless the legislature acts. Now, both the House and the Senate, the good news is both the House and Senate have passed variations of telehealth, and both of them embrace telebehavioral health. And I would ask the folks who believe that this is a good path forward, we certainly are weighing in on extending telehealth, that your voices be heard as the legislature conferences the bill, because other than Medicaid, so we will continue Medicaid coverage for telehealth and telebehavioral health, but commercial coverage would end with the declaration that we no longer have an emergency order in Massachusetts. So I think that's very important. I think also, Donna, you raised, I think another thing that's important is we took a very broad definition of what is telebehavioral health. And part of that is the equity lens. Not everyone has a computer at home or has perhaps, an iPhone. And so being able to use it telephonically, we wanted to ensure we did not create unintended consequences for people by only having it through Zoom or through your iPhone or iPad. So I would also encourage people to think about having as broad a definition of what the mode is for telehealth to be able to be provided. So we are, I'm working with our colleagues in the legislature to continue things that we would say have worked well during the pandemic, and I think this is one of them. And I think if there's others that people think would be useful, that would be very helpful. We are planning for a surge. I'm hoping that by planning for a surge, we won't have to implement anything, but we are much better prepared. And I want to assure people we have 5.5 months of PPE in the stockpile as an emergency stockpile if we need it. We have been able to, 3M is now making a sort of new version of N95, which we had tested by the major hospitals as well as by 1199 in the M&A in the past with flying colors. So we have major orders in for those and those respirators for folks. So we are planning for a surge, hoping that we never have to implement it. I don't mean to but we are planning as if, we will have some kind of surge in the fall as we come into flu season.
Well, on that note, we've actually had a couple of questions about the fact that the pandemic and flu season are about to collide. And for frontline workers, symptoms of seasonal flu and COVID are similar. And folks are going to have to attest if they have COVID-like symptoms, and yet it'll be hard to differentiate. And testing is kind of essential to, I think, parsing these things. And right now we have some delays in getting testing results, and that not only kind of delays the knowledge you need to manage and staff a program, but proper treatment as well, and tracking and tracing. And I'm wondering two things, I guess, that folks are wondering. One is the state efforts to increase testing capacity. And the second is whether there are thoughts about a mass educational effort to get people to have the flu vaccine.
Thank you. This will probably be our last question because it's 2:57. So we have 250 testing sites in Massachusetts, and the capacity at this time to test about 50,000 tests a day. Our goal is to create as much in-state capacity and to not rely on the national labs, which have actually like the 5, 7, 9 days. And I could show you a lovely chart, which I don't have available. I can send it to you, that shows how we've decreased the reliance on national labs in order to reduce the amount of time someone needs to wait for their test results. And have just released to a couple of large in-state labs the ability to ramp up their lab capacity with a commitment of 48-hour turnaround. So we've had a strategy to really, like the Broad is 24 hours, 48 hours max for turnaround. And we are working with Broad to increase up to 100,000 tests by probably October. So that's one piece. And apparently I had a threat about moving a bunch of my friends in the community health centers to Broad, and who've historically used Quest. And apparently that helped Quest to make a commitment to them in writing that they would reduce the length of time it took to get test results. So that was successful. I thought I was just trying to be helpful. That's one. Second, let me just end on flu. So first of all, we're about to engage fairly soon from the Department of Public Health a major flu vaccine push, public awareness, and alternative sites to get flu vaccines. As you know, we do mobile testing, for example, in some communities. I'm up for doing like mobile, like bringing vaccines to people rather than saying you have to go to primary care or even to a pharmacy to get your flu shot. So I've challenged the Department of Public Health to think very creatively about sites for flu vaccine. And then we actually, and I don't know how well known this is, we actually have, the Department of Public Health is now requiring flu vaccines on a condition to go back to school, to go to school. So you don't have to have it in order to go back to school, but in the course of the fall, if we have in-class learning, you need to have a flu shot unless you meet the exemption of religious or medical. And that is a first in Massachusetts, and that was a public health order that was signed. So we have a very high rate of flu vaccines for kids, but we want as much flu vaccines for everyone because the symptoms are so similar. So I think you're going to see an all-out push for flu vaccines, and we assume when people feel like they're flu-like, we're going to have to test people for both flu and COVID because that's what people are going to expect. So there you go.
Well, thank you, Secretary Sudders. This has been a really rich and responsive conversation. I'm so sorry we're out of time.
Me too.
I want to remind everybody that you offered to respond to questions that we didn't get to during the conversation, and we're happy to facilitate that process and get information back to everyone who registered. So on behalf of the Massachusetts Association for Mental Health, I want to thank all of you for joining us today. A special thanks to colleagues from the many organizations who shared questions and suggestions for today's event. But most important, we want to thank those of you who are working on the front line, supporting people with disabilities, people who are older and need help to stay independent or live their best lives, and people who are sick or injured or alone. Your work makes all the difference in the lives of so many people, and we just can't express enough our gratitude to you for your dedication.
Thank you. My heart to yours. Thank you, everyone. Please stay well, be safe, and we will get through this together. And thank you for what you do. And thank you, Donna. It's good to see you. Take care, my friend. All right. Bye, everybody.
Goodbye.